COVID-19 has had a significant impact on our healthcare industry and on people across the globe. Millions of people of all ages and walks of life have been infected. It is common for patients who have been hospitalized for COVID infection to have some type of cardiovascular complaint or issue. Q. How does COVID-19 affect the heart? A. COVID-19 can affect the heart directly by exacerbating a pre-existing heart condition, or by causing delays in patients coming in for care due to fear of using the medical system during the pandemic. COVID's direct effects on the heart may take several forms. COVID, like many viruses, may cause direct damage or inflammation to the heart muscle, called myocarditis. It may inflame the pericardium, which is the thin membrane that surrounds the heart, in pericarditis. Inadequate blood flow to the heart muscle, leading to heart damage, may occur through blood clots caused by COVID or through an incompletely understood process of inflammation causing disruption of coronary artery plaques leading to a myocardial infarct, also known as a heart attack. Severe lung disease, due to infection or associated blood clots from COVID, can cause failure of the right heart. Additionally, stress or severe illness, such as that caused by COVID, can induce heart failure, also known as stress-induced cardiomyopathy. Q. Can COVID-19 cause heart failure? A. Yes, COVID itself can cause heart failure, whether it's via myocarditis, myocardial infarction, or stress-induced causes. This can lead to significant blood or volume shifts within the heart that can lead to rhythm problems or electrical disturbances of the heart, as well as causing right-sided heart failure. Q. Are there similarities between COVID-19 symptoms and heart disease symptoms? A. Yes, many symptoms of COVID-19 are symptoms we commonly see in patients with heart disease. These can include shortness of breath, chest tightness or heaviness, heart palpitations, fluid retention, dizziness or passing out, and exhaustion. Q. Who is at risk for developing heart disease from a severe COVID-19 infection? A. We know there is an association between people who have pre-existing conditions, whether they are cardiac-related or not, and people at greater risk for severe COVID-19 infection, and therefore at greater risk for developing heart disease. These conditions include coronary artery disease, heart failure or cardiomyopathy, lung disease, immunocompromised state, diabetes, smoking and hypertension. Q. What is COVID heart? A. COVID heart, also called long-haul COVID, is a constellation of symptoms that may occur in people for many months after they have had a COVID infection. It can affect the lungs, the heart and the neurologic system. People can feel foggy and have headaches, numbness and tingling. These symptoms may be worse for people who have been hospitalized due to a COVID infection. Q. What should I do if I've had COVID and think I have related heart damage? A. If you are recovering from a COVID infection and you aren't getting better or seeing gradual improvements over time, you should consider underlying cardiac issues that are a result of the COVID infection or of a worsening of an underlying condition. It's important to seek care from your healthcare provider if you are experiencing any long-haul COVID symptoms or if your COVID symptoms are not resolving. Susan M. Salek, MD, is a cardiologist at MyMichigan Health.